Good afternoon. My name is Christy Covington, and as you all know, I am a nursing student and pursuing my bachelor's of nursing at Oklahoma Panhandle State. I am currently taking a class called Communication and Cultural Competence in Nursing, and today I am presenting about Latino and Hispanic culture and different communication techniques. The purpose of this presentation is to allow me to expand upon my current knowledge. Culture, what is it? It has many different meanings. It can mean an appreciation of fine art and literature, good food, or an intellectual achievement. For the purpose of this presentation, I have chosen a definition of culture. That means a group's way of perceiving, judging, and organizing their ideas that they encounter in their daily lives. That involves the sharing of values, history, customs, traditions, and superstitions of a people. These are passed down through many generations and become a culture that shapes an individual's world. The result of varied cultures have a high impact on a person's healthcare beliefs and behaviors. Choices made regarding their healthcare are firmly rooted in the individual's culture. It is important to realize that culture is not static. It changes frequently. New information and new influences are introduced into the group's knowledge, and these changes can result from scientific discoveries, while other changes can take place through acculturation. Acculturation means where we acquire other beliefs, approaches, and values by coming into contact with other cultures, either in our day-to-day communication or even on social media. Cultural competence is the continual process of striving to become increasingly self-aware, to value diversity, and to become knowledgeable about cultural strengths. Culturally competent nurses are sensitive to issues related to not only culture, but also race, ethnicity, and sexual orientation. Nurses, and all healthcare professionals for that matter, should have an awareness and knowledge of cultural differences and also their impact on health-related behaviors and their attitudes in their patients. Understanding and a non-judgmental approach, along with sensitivity, helps in dealing with people whose culture is different from your own. A nurse must also have flexibility when responding to and adapting to different cultural circumstances and contexts. Nurses should always strive to understand the different ways people act and communicate to ensure the best possible outcome for their patients. One reason nurses might not recognize or appreciate culture is lack of education. They may not have had that in their nursing program, and their place of work may not develop that. Nurses may not have an awareness of their own cultural beliefs and values. That is the first step before nurses can move on to accepting different cultural views in healthcare. Nursing programs should include appreciation for cultural differences in healthcare values, beliefs, and customs. Hospitals and other healthcare facilities should offer frequent in-service programs on cultural competency in order to increase their level of confidence and knowledge of transcultural skills. Spanish is the dominant language of Hispanics and Latinos and is the fourth most language used in the world. There are different geographical areas that develop different variants of the language also. Hispanic families have larger household size and greater prevalence of extended families. The most important social structure in their culture is family. Hispanic and Latino cultures vary in traditions and beliefs. There are multiple subcultures such as Colombia, Ecuador, Costa Rica, Cuba, and Venezuela, to name a few. A common characteristic of many Latino cultures include the avoidance of eye contact with figures of authority as a sign of respect. Nodding. This conveys that the patient is listening, but not necessarily agreeing with what is being said. If they are silent, it may mean disagreement or lack of understanding. Nurses should always ask questions to be sure the patient understands and clarify statements being made. Healthcare decisions involve the mother. She determines when it is time for the person to go to the doctor or hospital, and the male head of household, whether that be grandfather, father, oldest son, they give permission for that family member to go. Patients in the Hispanic culture frequently use home remedies or treatment from a folk healer before seeking out help from traditional Western medicine. One of the interesting things I discovered during my research was finding that the families prefer to be told about any bad medical news before the patient is informed. They believe that they are able to prepare themselves to support the patient when they do receive the news. Some Hispanics believe God determines the outcome of their illness, and they may not take any active part of their care and recovery. This may be an issue with nurses because for most of us, we like our patients to be active participants because that usually determines a better outcome. Therapeutic communication is one of the most valuable tools that a nurse or any healthcare professional can use to build trust, which is the foundation of a good patient-nurse relationship. This relationship can and usually does have a positive or can be negative effect on the patient's health outcome. In my opinion, the most important therapeutic communication technique in the culture is listening. Nurses must take the time to be active in their listening with their patients. They must listen to the patient's perception of the problem with both sympathy and understanding. Body language is very important in communication. You need to communicate that you are engaged and you are truly listening to what your patient and their family is saying. Open body language. It is very necessary. It includes arms being open, not crossed. When you cross your arms, you shut your patient off from you. You need to make eye contact comfortably without appearing to stare at that patient or their family. And you may lean toward the patient that's speaking. That just shows that you're engaged. While it is difficult to do, the nurse must put their own distractions aside to allow the patient to see them as caring and authentic. Another form of therapeutic communication is acknowledging the patient as an active contributor to the discussion and their health care. It is also important to discuss the difference and similarities between cultures, and that helps provide a framework for cultural competence for the nurse. In summary, it is imperative to understand diversity's impact on any healthcare encounter. Knowing the culture of your patient is central to understanding their health habits and decisions. There is an ever-growing number of patients from varied cultural backgrounds, which can cause a challenge to a nurse in providing individualized care. Nurses must be open-minded and have a sincere interest in learning about other cultures. The knowledge gained is important as nurses have the most contact with patients and their families. It is a necessity for nurses to understand, appreciate, and respond appropriately to their patients' cultural preferences to provide the best care. Does anyone have any questions other than OC? No?
Nope.
All right, thank you.